We need to have that national collaboration. If we're all talking in different language, if we're all talking about a different destination or a different vision, it's very difficult for us to get people higher up to actually listen to what we want, to make Eyecare something that people really listen to. There are so many other things there's so much noise around there about other very, very valuable parts of the healthcare system, but how do we keep Eyecare front and centre to make people realise the importance of patient sight, both economically, both from physical health, mental health. And we won't do that if we're all talking in different languages. We won't do that if we're not working together as a joint voice. That means we may have different views of how we're going to get there, but at least we ought to have a collective vision about what we think is the most important destination for our patients. We'll need to prioritise, of course we will. We won't be able to do everything at the same time, and I suspect many people around this room will get frustrated at the pace of change or wanting to do things for their patients that they can't enact because we haven't got everything quite aligned. So we need to prioritise, we'll need to test, it needs to be okay for us to try something and fail. We can't assume that everything we try is going to work. So it needs to be okay for us to be in this room and say, do you know what, I tried this and it didn't really work as much as I wanted to, but I tried this and actually I learned a lot. So we need to say it's okay to test, to try, to fail. And we need people to want to collaborate and work with us. We need people to feel okay to be in that uncomfortable space of transformation, of not quite knowing how things are going to go. So we need people to want to volunteer and help and engage with us and run pilots with us, because without that it's going to be very difficult to find the right path. And we need to define the success metrics. Obviously we've got our long-term outcome, but we'll need metrics along the way that will help us determine whether or not we're on the right path, and that's going to be part of that discussion.